Have you ever wondered how diseases progress in our bodies? Let's break it down into simple steps. And hey everyone, it's Dr. Ida Khan. Welcome back to Medico's Guide. In this video, we are going to be discussing about stages of infection and disease types, where we will have a detailed discussion of each stage with definitions, characteristic features, and examples and types of disease. So let's jump right in. So let's first discuss about the stages of infection, and there are five distinct stages of infection. So first one is incubation period, then prodromal stage, then period of illness, period of decline, and then the last one is convalescence period. Diseases have stages just like stories have chapters. Let's explore each stage in detail. So first one is incubation period, and this is a silent phase when the disease is brewing inside you. You feel fine, but inside the germs are multiplying. Examples include waiting for a cold to show symptoms, or waiting for COVID 19 to make you sick after being exposed. So let's get to a definition. So, incubation period is a time between initial exposure to a pathogen and appearance of symptoms. And during this phase, the pathogen begins to multiply within the body. Now, let's talk about the characteristic features. So, the person is asymptomatic, that is, the infected individual does not exhibit any symptoms during this phase. And there is silent multiplication, that is, the pathogens replicate within the body without causing noticeable symptoms. And also, this person spreads the disease unknowingly. Now, examples: the incubation period for the flu virus is typically 1 to 4 days, while the incubation period for the coronavirus ranges from 2 to 14 days. However, the duration of incubation period varies greatly and depends not only on the invading microorganism but also on the strength of individual's immune system. Now, now next is the prodromal stage. So now you start feeling a little off. You might have a headache, feel tired, or have a mild fever. It's like a calm before the storm. Examples include feeling a bit run down before getting the flu, or having a scratchy throat before getting a cold. So now let's get back to our definition. So the prodromal stage is characterized by the onset of non-specific symptoms that precede the full manifestation of the disease. Now, the characteristic features include mild symptoms, and symptoms may include fatigue, malaise, headache, and mild fever. And there is generalized discomfort. Individual may feel unwell without specific localization of symptoms. Now, let's talk about examples. So, in the measles, prodromal stage is marked by fever, cough, runny nose, and red eyes, while in chickenpox, prodromal symptoms of chickenpox include fever, headache, and loss of appetite. Next comes the period of illness. This is when the disease hits you full force. You have all the classic symptoms like coughing, sneezing, or high fever. It's like being stuck in bed with bad flu. Examples include having a fever and body aches with the flu, or experiencing stomach cramps and diarrhea with food poisoning. Now let's talk about definition. So the period of illness is a phase during which the characteristic symptoms of the disease are fully developed and most severe. Now the characteristic features. So first is the specific symptoms. Individual experiences hallmark symptoms associated with particular disease. And then there is functional impairment. So symptoms may significantly interfere with the daily activities and overall well-being of the patient. Now let's discuss examples. So symptoms of malaria during the period of illness include high fever, chills, sweats, and fatigue, while the period of illness for pneumonia is characterized by chest pain, cough with sputum production, fever, and difficulty breathing. Now we have a period of decline. So finally, your body starts fighting back. Symptoms begin to lessen and you start feeling a bit better. It's like the storm clouds clearing after a heavy rain. Examples include feeling less tired and congested as your cold starts to go away, or having fewer stomach pains as your food poisoning subsides. So, what's the definition? That is, the period of decline occurs when the symptoms of the disease start to gradually subside as the body's immune system begins to control the infection. Now the characteristic features include number 1, decreasing severity. So symptoms become less severe, and frequency of the symptoms decreases. And then there is improvement in the general condition, that is, individual starts to feel better and regain energy. Now let's talk about examples. So in the common cold, so during the period of decline, the symptoms such as runny nose, cough, and sore throat gradually improve. While in the gastroenteritis, the symptoms of diarrhea and vomiting become less frequent and eventually resolve during this phase. And now the last stage is convalescence period. This is the recovery phase. Your body has defeated the disease and you start feeling like yourself again. It's like coming out of a long tunnel into the sunlight. Examples include feeling energetic and healthy again after the flu or being able to eat normally after the bout of food poisoning. Now, the definition: the convalescence period is the final stage of the disease process, during which the individual fully recovers and returns to their pre illness state. Now, the characteristic features include complete recovery, that is, the symptoms have completely recovered and the individual's health is restored. Regaining strength, the body gradually regains the strength and normal function. Now let's discuss examples. In the flu, after the convalescence period, individual no longer experiences fever, body aches, or respiratory symptoms. And in the stomach flu, digestive symptoms such as nausea, vomiting, diarrhea have ceased, and the individual can resume normal eating habits. Now, let's talk about the types of diseases. So, the first type is acute diseases. Now, these are the illnesses that come on suddenly and typically last for a short time. And the examples include cold, flu, and stomach virus. Now, chronic diseases. These are the long term illnesses that may persist for years or even a lifetime. Examples include diabetes, asthma, and heart diseases. Now, the last type of disease is latent diseases. These are infections that may not show symptoms immediately but can become active later. Examples include chickenpox that can reactivate as shingles and HIV and AIDS. Now let's summarize the whole video. So first we discussed about the 5 stages of infection. The first one was incubation period, and this is the time between the exposure to a pathogen and appearance of symptoms. Then we discussed about the prodromal stage. This stage is characterized by the onset of mild, non-specific symptoms. Then there is period of illness. This is when the disease is fully developed and the symptoms are most severe. Period of decline. Symptoms start to lessen as body's immune system fights off the infection. And then the last one is the convalescence period. This is the recovery phase when the individual gradually returns to their normal state of health. Then we discussed about the types of diseases. The first one was acute diseases. These are the illnesses that come on suddenly and typically last for a short time. Chronic diseases, these are the long-term illnesses that may persist for years or even a lifetime. Latent diseases, these are infections that may not show symptoms immediately but can become active later. So that's all from today's video. Understanding the stages of disease progression helps us to know what to expect and how to take care of ourselves when we are sick. Stay healthy, everyone. Until next time.